Alright guys, we're just going to talk about the importance of MRIs or X-rays and when they should come into the equation. The first thing is when they should not be coming into the equation when it comes to treating low back pain. We get a lot of people coming in saying, I've got something going on with my back, I don't know what it is. We have a very good handle on what it is, but then they're not really happy until they get an MRI. And in that context, that's not a great start. Because MRIs can show up lots of degeneration, lots of wear and tear that happens anyway. It's part of the normal wear and tear, the normal aging process. And the main thing is that if you took 100 people from the population with no low back pain and you MRI'd their low back, and if they were like 35 or 45 years of age, like 50% of those people would have some disc degeneration, will have some bulging, will have wear and tear in their facet joints and degenerative change, so that's like that would be mild arthritic change, but have no low back pain. That's the big thing. No low back pain, despite all these findings in MRI. So the correlation isn't always that accurate, and that would be the one thing that we see a lot in clinic.
Yeah, and if you went and got that MRI straight away, that could be quite misleading. Then you may think that your pain is down to this specific damage in your MRI when it may not be at all. There's a lot of other things like movement patterns and biomechanics and muscle weakness and inflexibility, a lot of stuff like that is probably a lot more likely to be causing your pain.
Yeah, and going back to the guarding postures we talked about in the previous video, where people they're minding themselves and that muscle tension is on stretch here, and they think that's good to hold that position, and then the minute they bend, that's perceived as a bad thing. They'll feel that muscle tension kick in, and that will register as a pain or a stretch sensation. And if they're very, very hyper aware of the pain and in a guarded position and stressed out because of other life stressors, that will come on like, whoa, I should stay away from that. And they might link that back to the MRI result then, and that might necessarily not be the case.
So yeah, it may not be the case at all, but sometimes it may be the case. So the MRI may be exactly linked to your pain, and it may all make exact sense. But then it's still it's important about bear in mind that that's what normal spines can be like sometimes, and that the assessment and the treatment and how you present clinically and what we need to do to basically alleviate those issues. So, for example, if there's a disc issue that shows up in an MRI and you're constantly in that guarded posture or maybe hunched over a lot of the time, then we'd need to assess you in clinic and do some hands-on treatment maybe, and specific movement strategies to work with.
How do you work through it on a daily basis? Because we don't want you becoming reliant on us coming in here pressing buttons, because that's not the way it is. It's about us teaching you what you need to do for your back on a daily basis, and that means minding yourself, being sensible, and then doing some sensible exercises that help alleviate the pain, reduce it, make it more manageable so you can get on about your day and you will get through the back pain. Only 5% or less than 10% anyway need surgical intervention. So that's another big thing that you need to remember, and there will be lots and lots of signs and symptoms that come with that when you have a severe disc issue that needs surgical help, and even some of those you can get around it.
So 2/3 of disc injuries heal by themselves without surgical intervention at all?
There's only a very small portion of disc issues that need to go that far. So and again, we'll bust another myth out here while we're talking about the discs going in and out kind of thing. A lot of people think, when you come back in and they click my back and that's popping the disc back into place. That does not happen. That's not the case. So it's very important, because if you rely on someone to click your back, which is a joint manipulation within your back, not a disc in-out manipulation, that doesn't happen.
So say, for example, if the pad earlier on said 50-year-old male, 50% of people will actually have disc degeneration or a specific disc issue. So that may always be there, but maybe it's just more the positions that you put yourself in, or your movement patterns, or the lack of exercise that's actually causing that to be irritating some structures. So again, it brings back to doing the specific things you need to do to address those issues.
Yeah, so again, give us a shout if you have any questions about this. We'd be delighted to help out. Get onto our website, look at the back pain booklet and get some advice on that. We're here to help out. Give us a shout. Take it easy.